Good evening and welcome to Daily Stroke Rounds. This is an interesting and very exciting case, one of the most interesting and exciting case which I have seen in the last probably 1 year or so. Thought I'll share with you and get your feedback, suggestions, opinions and comments on this. These days, it's not uncommon to see the CT scan and see the report even before the patient reaches the hospital. Usually the report is WhatsApp to us before and then the patient reaches us. So this is what the report showed: mildly dilated and hyperdense basilar artery extending for a length of around 2.2 centimeters to rule out basilar artery thrombus. This is an emergency. So this is the story is like this. The patient is around 65. Patient was found lying unconscious at home, was taken to the nearby hospital. Patient was stabilized, intubated, put on ventilator. He was sent for a CT scan, and CT scan showed this. So look at the CT scan. The CT scan looks essentially normal, no major bleed. The basilar artery looks mildly hyperdense, but when you come down, the lower basilar artery and the distal vertebral artery, there is some hyperdense area here. Something is here. This looks hyperdense. That is the only abnormality which is seen. Otherwise, there is no major bleed to account for the. So, looking at the CT scan carefully, this is the area which is probably hyperdense. The basilar artery looks marginally white, hyperdense. There are two vessels. These are two vertebral arteries. So probably it is tortuous. That's why both are seen on the same side. It is dense here. We see the patient. Now we get to see the patient. So this is the patient in a ER. As you can see, people are clad in protective gear. Now it has become antigen first and then ABC. Examining the patient is connected to the ventilator. You can see the BP is being checked. That is normal. Patient is hemodynamically stable. His saturation, everything is normal. He's febrile. He's on ventilator. He's totally unresponsive. He's not moving both upper and lower limbs. Pupils are reasonably constricted and not dilated anyway. And patient is not responding to pain. Immediately we usually do the blood sugar to see hypoglycemia. That is not there. Take the blood for all the relevant investigations. The patient was given IV thiamine, which is a standard protocol, along with 1 gram of levetiracetam. We don't know the past history and all that, whether he's an alcoholic. So the patient there was absolutely no improvement there. Blood sugar is normal. The patient was taken up for a repeat CT scan, which showed that same hyperdensity here. But that is the only area which is abnormal. The basilar looks, this is because of the cut, but the basilar artery is essentially normal. On one cut, this looks like narrowing, this is not narrowing. The basilar artery is normal. And this is the distal vertebral artery and the proximal basilar, which looks enlarged. So that will not explain his unconsciousness. He is unconscious for the last couple of hours, not responding, not improving. We don't know what is happening. So the patient was taken for a MRI just to see if there's any brainstem infarct which has happened, a perforator infarct which has happened, or anything which we are missing. That is not there. It looks essentially normal. The distal vertebral artery is dilated, looks like a dolichoectatic vessel. There is a mild dilatation of the occipital horn. There could have been an old infarct, occipital infarct. That's all, but nothing new. So the radiologist felt it is a dolichoectasia. Is that maybe a DSA might give more information. So the patient was shifted to the intensive care unit. We put him on a continuous EEG monitoring, you can see. But the patient was maintaining saturation. The patient was disconnected to a he was put on a TPs, he was maintaining saturation, breathing was okay, but he was not improving. Clinically, he was not improving. There was no improvement in his sensorium. He was deeply comatose. Now, what comes to your mind? Should I have taken up the patient directly for the DSA even though the CT angio was normal? What else should I have done? Any other thoughts? This is just to get your opinion, your thoughts, how you would have thought and manage this patient if if you are seeing this patient in your hospital. The patient was, I think, around 5 hours. He was last seen normal at around 6 a.m. Reached our hospital by around 11. So it was beyond the window period. Should I have thrombolized the patient? I was confused, but I thought I had a feeling that we don't know what is happening, so might as well buy some time and see what's happening. So I'll stop here for the day. It will be continued tomorrow at 8 p.m. So unlike a post which comes in the group, this will be uploaded in YouTube as a channel. Started a channel called Stroke Rounds, Daily Stroke Rounds. So please do subscribe to the channel and click the bell icon so that every day it will be notified. And please send your thoughts, your comments, your suggestions for improvement regarding this case as well as regarding this this project personally to my number, so that it will be easy to respond personally. And I would like to hear your thoughts on this particular case. So it will be continued tomorrow.